UK, they prefer semen. Then sometimes they ask you, what is a gun maneuver? That Ahmed, have you heard about gun maneuver by Professor
Gun, G-U-N?
Gun, G-A-N.
G-N.
Yeah,
No.
but in UK they don't prefer that US method. But as a student, I receive both. You know, as a student, we have to learn multiple skills because some patients they won't work with everything. So you can use semen. If you want to work with semen, you can use gun. Okay. All right. So fully support, same. This is normally used for useful for patients that having mass. So vital problems. So you can use fully support. You support everything, head, neck, back, and everything. Okay. Sideline also the same thing. It's like a maneuver. Common issue, refuse. It's very common. Okay, normally in my clinic, I will do this one part. I will do, if a positive, I will do maneuver, and I repeat again this one part. How many times? I have done like, for example, like 2 or 3 sessions. After that, not discharge, give them another follow-up. Okay, I have done to one of our ENT surgeon, and she said keep doing, and we did for 8 sessions. So it's depends. If you are doing among your medical, you can keep doing. Alright, but for common people, you just do 2 or 3 times, and it's failed, just repeat again. And if still fail, refer to other friends. Sometimes you need to get appointment from opinion from your ENT, from your neuro. So please refer. Then roll test. Okay, you can see here. This is a horizontal canal. Anyone seen horizontal canal BPPV? I have seen 2 cases in my life for 20 years. Horizontal canal BPPV. Anyone? Mr. Sada? Anyone see anterior canal BPPV? Anterior, rotary, downbeating. Anyone? You have seen? I have seen 2. So it's quite surprised, and you do barbecue maneuver. Barbecue, you remember when you do party? You just rotate them 360, and inshallah everything good. Alright? So, conclusion. If you have BPPV, I don't want to repeat, I think Miss Dr. Ahmad having a very good lecture slide. You can get your slide later, inshallah. Someone request from me.
Inshallah.
Okay. So, vertical canal, torsional right, most probably right canal, torsional left canal, upbeating. This is a basic concept. Okay, don't be shy. If you are confused, right, left, upbeating, downbeating, refer back. Okay, and alhamdulillah, before I'm leaving here, I'm launching all my maneuver free in YouTube. Because the rule in American Institute of Medicine, anything that you learn in there, you cannot publish in YouTube. You're going to be blocked within 5 minutes. So I'm recording again with my intern, and I give it to public. Because some of you really don't know where to find guns maneuver, semen maneuver, Ibri maneuver. Everything was available in Dr. Zuraida Zainal YouTube. It's free. Go there, access, and use it. Alright? Duration less than 60 seconds, catalysis. Duration more than 60 seconds, conclude. This is what the method of latency and latency. You have to wait. For BPPV, you have to wait because there are 2 shots, cupulo and cannulolysis. And then horizontal canal is going to be geotropic and also the geotropic. So this is more advanced.
Prof, just to clarify a point, like upbeating nystagmus. You have to be careful without explanation because pure upbeating can be also, or pure upbeating vertical can be central.
Yeah, good.
So be careful with what you mean by upbeating. Because upbeating, rotational, it is positive. But pure upbeating nystagmus is central, indicating central issues.
Exactly. The Ahmad is true. This is going to be mixed. Normally, in peripheral, is a rotary upbeating. Rotary downbeating. It's a pure vertical, is most probably central. That you need to refer to neuro, and you have to do central, and you have to do MRI brain. Okay? So this is one of the table. The reason why I'm saying to you, why you have to choose whether Ibri, gun, or semen. You can see here, it's an Ibri maneuver. The recurrent rate is actually 30%. This is the reason why some people in some practice they don't use Ibri. They prefer semen because the recurrent rate was 4 years, and in my clinic, I have seen after we do Ibri, people become quite 2 years. they will come back. But after semen, I can see my clinic now after 4 years, 3 or 4 years, they will come back. So in terms of selections of the maneuver, you need to select the lowest recurrent rate to your patient. Okay? Then, if you can see here, gun is not bad. By Professor Richard Gunn from US, they mentions that, but the sample size is quite, the sample size is quite high, 220, and you can see here the recurrent rate is 5%, it's almost semen. And this is conclusion in terms of the treatment you can choose. For posterior canal BPPV, you can use gun CRM, semen, modified FP maneuver, and also for anterior deep hanging maneuver. You can find easily in the YouTube, and also horizontal canal, because I don't want to focus more on the anterior and horizontal, and because this is not really common. You just focus on the posterior canal. But if you have patient in anterior or lateral, you can proceed with this maneuver. Okay, so I just want to see gun. Okay, gun maneuver. The difference between gun and FLE is actually only shaking. Exactly same. FLE is a simple maneuver that I think everyone know, but during gun they are shake. You can see here. Okay, they are doing when you decide, patient are having, for example, like right, VPPV. So everything needs to be contra side, left side. Okay, you see here? After you explain to patient and you do the test, is it the sound? Okay, then this is gun CRM. So you need to do the same thing as usual. Okay, and you turn. This is what we call right. This one by test. Okay, right, this one by test. Turn down and visualize these segments. Let's say this is a positive. Okay, let's say you are having rotary upward, posterior canal. Okay, and then you have to start the treatment contra side. You need to turn to the left. The problem, right. The treatment, contra, left. You need to remember the treatment, everything was contra side. Okay, good. Then wait. Sometimes I'm using chair if you don't want to bend. Because you have to wait. You cannot be in hurry. Every step you need to do, you have to rest and wait. Okay, then turn the body first, not the head first. You should remember. If not, you have to refer to Mr. Saleh for the dislocation. You have to turn the body first and turn the head and wait. Make sure the nose is pointing down. And now see how I'm shaking. The shaking is very important. I learned the shaking is almost 1 to 2 years. Yeah, it is really not. It's not. You have to do very small shaking and confident shaking. For those who are joining me in this one before, I already teach you. You can find the ball. You can try. Normally, I will teach my student. You need to hold your elbow to the body and take a ball and confident shaking. 1, 2, 3, 4. Confident shaking, downward. And energy, not to, no, it's not working, alright? You have to do confident 1. Normally I start with 4 to 8. 1, 2, 3, 4. This is different between gun and FE. FE, no shaking. Gun, shaking. Alright, that's all. And semen, yes, I will show you the semen. This is very important, and now I love to use semen. I love to use semen, to be honest. But the weakness of semen, if you can realize, normally when you do the whole pipe test, straight away you can do FE or gun. But for semen, when I do attachment in UK, they don't do the whole pipe. They just assume, okay, the patient complained, I cannot sleep on the right. So they assume right BPPV, they proceed with the semen. They don't do this whole pipe. So normally, that's why people don't prefer to do semen. You know why? Because when you do this whole pipe, you ask patient to wake up again. You see? So this is the why. But now I'm trying to follow my teacher. Okay, I'm doing the semen. I'm trying to follow after certain year. Okay, can we proceed? It's not working. It's okay? It's not working. Oh, sayang. It's okay, I will demo. Alright, that's all. This is my patient, the semen maneuver. Okay, can you play this? Alright, good. The same picture. See? This is semen. So this patient, I assume, let's say, this patient having problem on the left. So turn right, that means face up and face down. This is semen. Face up, face down. This is the concept.